Hello, my name is Jim Byers, and I'll be discussing endometrial cancer for this women's health issue presentation. Endometrial cancer is a disease that primarily affects postmenopausal women at an age of 60 years at the diagnosis. Risk factors include postmenopausal estrogen therapy, obesity, a high-fat diet, reproductive factors like nulliparity, which is not having a previous child, early menarche and late menopause, polycystic ovarian syndrome, and tamoxifen use when treating breast cancer. Women with Lynch syndrome, which impairs DNA mismatch repair, have a markedly increased risk of endometrial cancer compared to the women in the general population. Signs and symptoms include abnormal bleeding, which is the presenting sign for 80% of cases. In some cases, an obstruction of the cervix with a collection of pus or blood will cause abdominal pain. Usually, abdominal pain occurs late in the disease with metastasis or infection. Diagnosis of endometrial cancer is unlikely with a pap smear, though, as it is not sensitive to the test. Therefore, endometrial tissue sampling is the only reliable diagnostic test for diagnosis. Vaginal ultrasound can be helpful in diagnosis because the thickness of the uterine wall can be examined. If a hypertrophic wall is noted, it can be a sign of cancer. Once diagnosed with endometrial cancer, it is important that certain diagnostic procedures are done to stage the cancer. Treatment includes total hysterectomy and bilateral salpingo-oophorectomy. Depending on stage of endometrial cancer, the patient may or may not need chemotherapy and radiation. The overall 5-year survival is 80 to 85%. With stage 1 disease, the depth of the myometrial invasion is the strongest predictor of survival, with a 98% 5-year survival, with less than 66 depth of invasion, and 78% survival with 66% or greater depth invasion. The importance of endometrial cancer is nursing is simply that it is the second most common cancer of female genitalia. Knowing that some risk factors of endometrial cancer are preventable, we are able to educate our patients about the disease and its modifiable risk factors. Healthy People 2020 is a government initiative for overall health goals for the United States population. Endometrial cancer was not discussed as part of the goals of 2020. However, goals related to overall cancer prevention was mentioned. I believe endometrial cancer was not discussed because Healthy People 2020 trend cancer rates, and endometrial cancer is not one of the most commonly preventable cancers by modifiable risk factors. The overall cancer prevention goals mentioned were use of tobacco products, physical inactivity, poor nutrition, obesity, and ultraviolet light exposure. You can see that these modifiable risk factors for overall cancer prevention mimic some of the modifiable risk factors for endometrial cancer. Etiology. Estrogen drives endometrial gland proliferation, therefore pharmacological exposure to estrogen is a risk factor for endometrial cancer. Causes for increased estrogen production are obesity, which increased serum estrogen, and women treated with unopposed estrogen without progesterone, estrogen-producing tumors, DNA mutations, and tamoxifen use. Tamoxifen is a drug used for breast cancer and causes an anti-estrogenic effect in breast tissue. However, tamoxifen causes estrogenic effect in uterine epithelium. Progesterone drives glandular maturation and is protective and should be used in conjunction with estrogen therapy. Birth control has been shown to decrease endometrial cancer risk due to its prostrogenic effect against estrogen production. Endometrial cancer may not be the most common cancer among women, but it is a global health issue, being that it is the sixth most common cancer in women worldwide and the 12th most common cancer overall. In 2008, there were almost 300,000 new cases of endometrial cancer recorded worldwide. This disease most commonly affects high income countries as compared to low income countries. Endometrial cancer can strike any woman, but those who make up the target population include white, obese, nulliparous women who are postmenopausal, usually in higher income populations. Cancer of any type has an overall negative effect on the individual, family, community, and society. The individual may express emotional stress, including fear, anger, guilt, depression, sadness, and grief. A financial burden is also felt through the treatment, especially for the uninsured or lower income individuals. It is estimated that the initial cost is over $25,000 for women 65 and older diagnosed with endometrial cancer, which includes the initial diagnosis through the first year and then the last year of life. The continuing period is estimated at over $1,500 per person, which is the period in between the initial and last year of life. Due to treatments and surgery, the patient will also have physical stress, which can leave them unable to perform activities of daily living and need daily assistance. Families will also carry emotional and economic stress as well, when caring for a sick loved one. Society will feel an economic stress and direct medical costs and indirect mortality costs. There are many ways to improve the quality of care for patients who are at risk um, or who have endometrial cancer. It is important for nurses and providers to first create awareness of the disease. Patients will be better informed of signs and symptoms to look for or to change habits that are modifiable. Encouraging annual gynecological exams and learning about Healthy People 2020 is a great start. It is important to identify those who are at risk and discuss preventative strategies such as weight loss and smoking cessation. Support groups continue to be a wonderful tool for those who have already been diagnosed with endometrial cancer and their families. I was interested to learn the cause of endometrial cancer and that it does have modifiable risk factors. Knowing the risk factors encourages discussion of preventable strategies that can be used to educate those who are most at risk. In summary, endometrial cancer affects the lining of the uterus. It is the most common in white women who are between the ages of 50 and 70 years of age, and it is the most common invasive cancer of the female genital tract. Some risk factors are modifiable, including a diet high in fat and obesity. These can be prevented by incorporating a low-fat diet and an exercise program to maintain a healthy weight. Giving birth or using oral contraceptives are also helpful in preventing endometrial cancer. Being aware of the target population and risk factors for endometrial cancer helps us as nurses to educate our patients and increase the preventative strategies for the disease. Thank you very much.